Hey, Dr. Karen Can here. I have been with LifeWave for, as of this recording, about 16, 17, almost 17 years now, and I absolutely love the stem cell phototherapy products. Now, in this series, which I call the LifeWave Mistakes mini series, I talk about some of the misconceptions and myths that people have around being able to use the LifeWave patches in a really awesome way, and or things that have to do with what gets distributors stuck in terms of marketing and sharing this beautiful, amazing technology with other people. Now, today's lesson is around relying on recipes. So, this is really talking about an approach, and this is both for distributors as well as new customers of LifeWave. So, what I've seen over my many years working with thousands of people from around the world is that there is an immediate belief or feeling once they, get interested in LifeWave and see what amazing things that can happen. They're looking at the pictures and like, oh my gosh, this person's scar went away. They look, 20 years younger. Their wrinkles are going away. The bags under their eyes are going away. Their wound is so much better. They have little or no pain anymore. Their energy's great. They can play with their children anymore. They can climb the stairs. There's so many amazing results and testimonials, and of course, 80 plus clinical studies to back them up, that they feel, well, what's the formula? What's the recipe? One of the first things they ask their distributors, where should I put the patches? And they've got all their little patches and they're like, okay, what's the recipe? I have, a condition. Well, first of all, we have to be really careful is that here in America, the FTC and FDA does not allow us to make claims about things. And even if we did studies on, conditions and illnesses, we'd be considered in the same realm as a drug. And we don't want to, don't want to go there, right? It's a wellness product, a holistic wellness product. So we can't talk about treating or curing any diseases or preventing any diseases, things like that. But people get so into that. And we talked about that in another video. So I won't go over that again, but they're like, okay, so I can't talk about my arthritis, but I want to talk about my knee. So like, well, I have knee pain and swelling and the cartilage is disintegrating. Okay, so what protocol should I use for that? Or they might say, well, my thyroid isn't working as well, knowing full well that they can't say they have low or high thyroid or Graves' disease or any of those terms, right? They say, well, my thyroid, I'd like to support, when they get good at asking the right question, I would like to support my thyroid in being healthier. Okay, that you can say. Then they go, what's the protocol for that? Right? Well, here's the thing. The patches, although small, actually share a frequency or frequency sets with the body's energy field in the infrared range, and it communicates to the entire body. In other words, you can use one X39 stem cell enhancing patch pretty much anywhere on your body and it'll still work. So unlike stem cell injections where you kind of inject the concentrated stem cells where you have the problem and then the rest of your body, well, too bad for you, the stem cell phototherapy is that you can put one patch in your body and it quote unquote treats, the whole body. Now, the exception, of course, is the ice wave. The ice wave is a pain relief patch. It's a set of two, a white and a tan. And that, in order for those to work really well, you really should do one of the protocols that are in the brochure to make sure that the pain is going away because it's usually immediate within seconds or minutes. Then you know you have them in the right spot. So you can't necessarily put those anywhere. Okay. And there are rules on, patching, whether you patch midline, right hand side, left hand side. There's very few that go on the left hand side, primarily SP6 being one of them. Now, so if you don't rely on recipes, well, what are you supposed to do? Right? Here's the thing. You don't need a recipe for the grand majority of things that are going on in your body. You just need to know what the symptoms are and pick the patch that is appropriate for that symptom or for that goal that you want. And then take a look. The patches come with brochures. Yes, they come with brochures. These are instructional brochures for each of our patches. Okay. And they teach you where to put the patches. Now, the points that you see in the brochure have been clinically tested. In other words, here in America, they're very strict. So we can't put a patch over this point anywhere in the brochure, or at least corporate can't, anywhere in the brochure if it has not been tested and proven to be safe and effective. Can you use it other than what's in the brochure? Yes, but I'll get to that in a moment. So here's the thing. Once you figure out what your goal is, whether it's pain relief or anti-aging or skincare or detoxification, immune system, or decreased stress, right? We have patches for each of these things and more. Then all you got to do is follow the instructions in the brochure. Why? Because 80%, in my personal experience as a clinician, and being with LifeWave for 16 something years as of this recording, um, 80% or more of people do really great just using the instructions in the brochure. They do not need any fancy recipes. Right now, there are organizations and distributors out there who do have sites that you can buy a subscription, and they will give you formulas and recipes. And I'm not saying that's wrong. I'm saying do what works. So here's the thing. If 80% of people do really well just following the instructions in the brochure, right? There's going to be a proportion of people who think they have to follow something more complex. And when that happens, you're actually creating a barrier between that person getting good results and because they feel like they need to know more. In other words, they almost feel like they need to be an acupuncturist. And that was one of my biggest mistakes when I started the LifeWave business part, is because I was an acupuncturist. Right? So I was all about, oh, I can use this point for this point for this. And I got super fancy. Well, it totally did intimidate my patients, but of course they were seeing me every other week, so I could tell them exactly where to put it, right? But for the average person, that's totally intimidating. You do not need to have the skill set of a medical doctor like myself or an acupuncturist like myself to get really amazing results with the patches. And even just the X39 and X49 alone, okay? Or even just the X39 alone. 2 points that are in the brochure. Alternate the two. That's it. Right? And people get fantastic results. They get fantastic results up here. They get fantastic results down there. They get fantastic results on their knee. Can you put them in other places? Yes. Can you use a recipe? Yes. But don't feel obligated that you have to, sign up for X number of dollars a month to a site because you feel like you need to learn all these recipes. It's impossible to memorize all these recipes. And here's the thing. In Chinese medicine, we don't use recipes. Let me say that again. In Chinese medicine, acupuncture, we don't use recipes. Why? Because in Chinese medicine, we see each person as a unique individual, and we do an assessment on that person based on their symptoms, their signs, their energy, the direction of their energy, right? So we're doing tongue diagnosis, pulse diagnosis, dietary change, all these kinds of things. And for that person, for example, let's take heartburn. Okay. So heartburn in Western medicine is heartburn, right? One diagnosis. What is it? It's acid going up into the esophagus for the most part. Some people believe, like inaccurately, that it's too much acid in the stomach. Very, very few people have that condition of too much acid. Okay. Most of the time, it's acid going into the esophagus, right? So that is the label for this condition. In Chinese medicine, there's at least 5 different ways and energy imbalances that can cause the exact same symptom. And if you were to use acupuncture and or herbal therapies in Chinese medicine, you would give each of these 5 people different formulas, i.e. different recipes. So if each person has a different constellation they have the same symptom, but they have different constitutional energies, right? Different imbalances. One person might have spleen qi deficiency. One person might have rebellious lung qi. One person, you know what I mean? So there are patterns for sure, but it does take an acupuncturist to diagnose these things, right? So why would you think that one recipe is going to cure your heartburn? That being said, there are some points that are very helpful, like right over the stomach, where you can use patches, right? But if you feel like you need to have the recipe, okay, oh, I have, I don't know, heart palpitations. What's the recipe for that? Well, it kind of depends on other things going on. Now, you might go, well, Dr. Karen, I've been following you for quite some time, and you have micro trainings where you have recipes on there. So aren't you really just, saying the opposite thing today? Well, no. You could argue it is, but no. Now, there's a balance between, giving people what they want, okay, but also letting them know that there's certain things they do not need, even if they want it. So the LifeWave micro trainings is kind of a compromise on that. I do give some formulaic points, acupuncture points, and these are usually common points that are often used and not specific to a particular, often not specific to a particular kind of constitution. But I always say in the videos, that you don't have to use this formula because it may or may not work for you. But a lot of people who, are given a recipe think that's it. That's the one recipe for heartburn. And if it doesn't work, that means the patches don't work. That's not true. If it doesn't work, it could be you have too many patches on. It could be you're detoxing. It could be you're using the wrong patch for your particular, issue, right? And there could be lots of reasons. So don't make this LifeWave mistake is where you feel you need the perfect acupuncture, recipe, because in real Chinese medicine and acupuncture, we don't give one size fits all. It's exactly the opposite philosophy in Chinese medicine. Chinese medicine is all about individual therapies. So I would much rather people look at the principles of it, right? Like 80, 85% of people are going to do just fine with the brochures. And, if you don't, start there. But if you don't, then certainly you can ask for help. You can certainly look at the micro trainings. You can certainly ask questions in our monthly Q&A with Dr. Dennis. Mind you, it's very complex, okay, the stuff that he shares, because he's, an amazing, brilliant guy and, has a thorough understanding of Asian medicine, much more than I do. And they can get pretty complex. But in this case, when people call in, he's asking them questions. Do you have this? Do you have that? What is it like? Right. So he's giving them a formula based on what they're saying. Now, sometimes he'll say, well, I can't know for sure because I need to examine you, check your tongue, your pulse, to really know for sure what's going on. Do you have excess heat? Do you have excess damp? All these kinds of things. So I don't want this to feel like, oh my gosh, this is even more complex. It's not. I'm actually simplifying it down for you. Do what's in the brochure. Okay. Start slow. Go, if you make changes, make it, not like all at once, just a little bit at a time. Ask your upline distributor for support. That's what they're there for. If they don't know the answer, they can ask someone else upline of them. Usually on every single team, there's at least one clinician, okay, that has a lot of experience. On my team, we have a bunch, okay, because they tend to gravitate to me. So we have a lot of acupuncturists, massage therapists, and holistic health people, and blah blah blah, right? So they're more than happy to play with patches and help you with getting the best results. But just don't rely on a single recipe for a particular symptom. And hopefully they're not talking about conditions, but for a particular symptom, because it might not be relevant to you. And if it doesn't work, it doesn't mean that LifeWave patches don't work. There could be other reasons that it doesn't work in that way for you. So again, just to summarize, use the points in the brochure, because over 80% of people get great, amazing, fantastic results just using those. Now you might say, Dr. Karen, well, they don't say in the brochures how to do combination patching. I know. We did do some of that, David and myself, in, I believe, 2020 in the Amplify convention. We had a class on that. His favorite combination points, my favorite combination points. Is it Is it in a brochure? No. And like I said before, the reason is because of the strict regulations that unless there's a thorough clinical study on a particular recipe, they can't publish it. At least corporate can't publish it, right? So you're you're best to look to your upline, or can check my micro trainings to see if there's a symptom there that you have. You can try the fancier patching protocols, see if they work for you. If they do, awesome, then that pertains to you. If it doesn't, look elsewhere, and don't give up on the patches, because that acupuncture point may or may not be appropriate for you. There are other things, that may not, you may not get results as best as you can because you're not hydrating, for example, or you're not, you have a terrible diet and you're not getting enough protein or minerals or some other thing that might block the patches from working well. So definitely rely on your upline. And for example, I have two groups on Facebook. One's called the LW, which spells LifeWave phototherapy patching group, and I am streaming live into you guys right now, as well as my patch training team customers and distributors. The latter is only for my team, and I and administration for that. The first one, Anna Kadena, is administrator for, and she's incredibly helpful and generous with her time, even though most of those people are not on our team. And let's share. We can share some ideas, and that's okay. Share ideas. Try this, try that. For me, it's like whatever works. It's very easy to play with the patches, and they're very, very safe. You can't hurt yourself by, patching wrong, if you will. You just normally, if you patch the wrong way, you may not get results, but you're not going to hurt yourself. It's not like a drug that you take the wrong drug and your blood pressure drops and you have hit your head or something like that, right? It's not that kind of thing. So, ask for help, get some support. Please know that customer service and LifeWave is not allowed to give you advice in terms of conditions or symptoms of where to patch. They're just going to refer you back to the brochure and your upline. So don't ask them for recipes. And for those of you that really enjoy the various sites that have a membership and they sell recipes, if it works for you, great, keep doing it. If it works for you, just keep doing it, right? Just be careful about recommending everyone to do the same, because it's one extra barrier to actually using the patches and using them easily. Simple is best. So if it gets too complex, I know people that are like, they just start in the company as a distributor. They bought into one of these recipe sites and they're wearing 6 patches and they're asking me, why is it not working? Okay, we don't want to see that. All right. Because they're like, well, there's something wrong with the patches. I'm like, not exactly. You're using 6. I'm not really sure you really need 6 right now. What is it you're trying to do, right? Well, I'm trying to cure my thyroid. Okay, let's step back a little bit. So I will continue putting recipes on the LifeWave micro trainings, but keep in mind, as I say, for all of those trainings, this may or may not work for you. These are some common points that may be helpful for some people. If it works for you, great, use it. If it doesn't, try something else. All right, so I hope this has been helpful for you. If it has, definitely, if you're on YouTube, like and subscribe to my channel. And feel free to share this video. I also have been streaming this into my Facebook page, which is public, which is the LW Phototherapy page. So you can go ahead and share from there as well. If you're inside a Facebook group that's private, you cannot share this outside the group, but just know that there are other versions of this, both on my YouTube channel and the LifeWave or LW Phototherapy business page, where you can feel free to share it with whoever you think might want to learn from this. And if you are brand new to LifeWave, or want to try LifeWave, do not have a distributor with you, and or to work with, and you're just hearing this, you're like, wow, this is really interesting, can I learn more? You can definitely check out Patch Training Team, which is my team's site, and get a free consult with 2 of my leaders, just to see if trying LifeWave is right for you. And if somebody else referred you to this video, definitely go back to them for help and support, because they're the ones sharing with you this technology, and they are really trying to help you. So I'm just going to check in to see if, since I am streaming this live, just to check in the chat to see if there are any questions that I can answer for you. Okay. Yeah, so Marcia said, "I wanted to know exactly that, where to place it." Yes, for the X39, the really great thing of X39, X49 is very flexible. You can put them on the brochure points, of course, and you can pretty much put them anywhere. So, for example, some people have had an injury, and because they know X39 helps to heal the wound very, very quickly, they will just put the X39 somewhere near the wound. Maybe not on top of the wound, unless it's on top of a band aid or something. Or if it's in a cast, you can put it on top of the cast, it still works, right? So you can put it near the spot that you want extra, attention on. Now, why does it maybe work better there? Well, it depends. I mean, a lot of people do think it works better closer to where you have the issue. The reason could be because you have a lot of acupuncture points all over the body, right? And you could be double dutying. You're having the X39 do what it does, but also activating the acupuncture point near that point. For example, if you have a knee pain or cartilage issues in a knee, instead of putting the X39 on the brochure points, you could put it on somewhere near the knee. You might end up hitting like stomach 36, which is a great point for the knee, right? It's a great point for the lower body, right? And if you're anywhere near that, you'll stimulate that point, and that could give you better results. Um, okay. Well, not really. I mean, Marshall's asking, do they have to be on an acupuncture point? Not really. I mean, if you want the benefit of that point, what classically it does, and the benefit of the frequencies in the patch, then yeah, put it on an acupuncture point. But literally just putting it, according to the brochure will give you great results. Again, the LifeWave ice wave patches for pain, you definitely need to play with them. There's a clock method in there, and that, like we're expecting, at least 50% decrease in pain within minutes because it's very fast if you put in the right spot. So in that case, you don't just put them anywhere. You want to put them in a spot that decreases the pain. Then you know it's the right spot. Okay. Thank you, David. I will work on that. I don't know how many lives you do, but it is definitely a challenge. So David saying, I'm saying a lot of you knows. You're absolutely right, I do, I do. And like I said, you might be really good at doing live streams, and I just want to get the information out there to people on a Sunday, on my day off, because it's really important to me. So that's the most important thing for me, not to be perfect, but to get the information out there. And I know people appreciate that. Beth says, what's the shelf life of the patches? That is a great question. Oh, I said, again. It is previously when it was labeled homeopathic as well, there was a due date or shelf date or whatever of 2 years. However, that being said, if you've kept the patches in a place that is cool meaning not in the hot sun and not, I don't know, near a cell phone or a router or something, like nobody stores their stuff there anyway. If you've kept it in a drawer, for example, then they last years and years and years. There's no reason to believe that the crystals, the nano crystals inside the patch, by the way, they do not go outside the patch, right? Nothing goes through the skin. There's no reason to believe that they would disintegrate on their own without touching your body and having that infrared signal to activate. So I have found patches that were 10 years old and they still work. And for most of us, we love the patches so much. We get so much out of it. And I really like the whole reverse aging thing. It's really working for me. I love it. So I use mine pretty much every day. Now, I don't have a lot that are 10 years old anymore because I use it every day, use it consistently. Why? Because, hey, I have lofty goals. I like being busy. I like being productive. I like increasing my athletic performance with age as opposed to decreasing like most people. And I'm competitive. Yeah, I'm a competitive figure skater. So, hey, if I can do better as I get older, awesome. All right, let me see if there's any other questions. All right, I don't see any other questions. Thank you so much for joining me. And if you are on YouTube, remember to like and subscribe to my channel as I will be doing more of these over time. And bless you all and have a wonderful rest of your day.